Hi doctors, welcome to the new episode of our A to Z series where every day alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is Episode J where J stands for Japanese Encephalitis. So let's begin the discussion with solving some previous year questions and later we'll discuss the key features of this topic. So the first question for today is which of the following disease follow a bird arthropod human transmission route? Option A malaria, option B Japanese encephalitis, option C plague and option D paragonimiasis. So which option do you think is the right one? Well yes, option B Japanese encephalitis is the correct option. So let's move forward to the next question. Which of the following is not true about Japanese encephalitis? Option A transmitted by Culex vishnui. Option B pig is the amplifier host. Option C man acts as the reservoir. And option D human is the dead end host. So which option do you think is the correct one? Well right, option C man acts as the reservoir is not true about Japanese encephalitis. And the last question for today is amplifier host of Japanese encephalitis. Option A pig, option B dogs, option C cats and option D birds. Well yes, the correct option is option A pig. So now let's understand the key features of Japanese encephalitis. Japanese encephalitis is a viral infection caused by the Japanese encephalitis virus, which is transmitted through a bird arthropod human transmission route. The primary transmission cycle involves mosquito Culex as the arthropod vector and ardite birds as the reservoir hosts. Mosquito acquire the virus by feeding on infected birds and then transmit it to humans through their bites. Humans are the accidental host and pigs are amplifiers. So this is the natural cycle of Japanese encephalitis, where everything begins from Culex mosquitoes. Water birds are amplifying or reservoir hosts, pigs are the amplifying hosts, horses are dead-end hosts and humans are dead-end hosts. So now let's talk about the host factors of Japanese encephalitis. The most common age affected is below 15 years. Pigs, they are the amplifier host, doesn't develop the disease but maintain the viremia. No manifestations of the symptoms. Birds are diet birds, pond herons, ducks and poultry. Maintenance hosts maintain the life cycle of viruses found in natural reservoirs. Man, accidentally or dead-end host, no man-to-man transmission. Cattle and buffaloes act as a mosquito attractants. Horses, only animals that manifest symptoms. The signs and symptoms of Japanese encephalitis include sudden onset of high fever, disorientation, headache, stiff neck, seizures, coma and paralysis in severe cases. Now let's summarize Japanese encephalitis. Mosquito-borne, life-threatening viral disease causing swelling of brain. Affects 30,000 to 50,000 people every year globally. First clinical case was recorded in 1871 in Japan. Only 1 in 250 people infected with JE virus developed symptoms. Symptoms include fever, headache, neck stiffness, and convulsions, diagnosed by blood tests and CSF examination. Treatment involves supportive care. There is no antiviral therapy. JE can be prevented by vaccination. Patients who survive develop lifelong immunity. Complications include deafness, paralysis, coma, and death. So that's all for today. Thanks for watching. See you in our next episode. That will be episode K.